Okay. All right. So, hey, this is Sean Del Grego. I'm a doctorate level PA that's going to be sitting in the DOT physical for this upcoming DOT session. This is a physical exam portion of it, so that way, as a medical examiner, I can actually take care of DOT drivers. It's not going to practice medicine. It's just going to say you pass or fail the DOT requirements. All right, so. All right, these are notes for myself. Getting ready to get on the road. It's an hour drive over there, so I'm going to make this quick, easy, down and dirty, so that way I know I'm not missing anything. I'm not sure if this is even going to work well. Okay. All right. PO2 levels recommended for a driver that has an ABG due for chronic respiratory disorders. 65 millimeters of mercury is the magic number we need. So to be qualified, the driver must have a minimum arterial blood gas of, greater than 65 millimeters of mercury. It has to be greater than. All right. Whisper test, 5 foot. If it's 5 foot in one ear and 4 foot in the other ear, that's a pass for 2 years. If it's less than 5 feet in both ears, then that's a fail. They'll need to go on and get a hearing test, actually, and that will allow us the ability to see whether or not this person needs hearing aids. If they have to have hearing aids in, then they need to have hearing aids in when they drive as well. All right, so driver reports for an examination 6 weeks after suffering a mild heart attack. Because it's only 6 weeks, that right there is a disqualifier. You gotta make sure that they are greater than 2 months in a waiting period after a heart attack. And then you can only give them a max clearance for 1 year. All right, so heart attack, just remember, has to be at least 2 months, and the max clearance is gonna be 1 year. Driver provides audiometric exam. Both ears have to be greater than 40. So they don't care about the 400 hertz. What they care about is 500, 1,000, and 2,000. As long as you meet that requirement, then you're good. So driver provides this exam. 500 is 35 and 40. 1,000 is 40 and 45. 2,000 is 40 and 45. 4,000 is 50 and 50. Averaged up, it needs to be greater than 40 in at least 1 ear. So you certify this driver for 2 years. And this explains that as well, what I just said. During the examination of a commercial driver, the examiner notices the driver's peripheral vision is 70 degrees in the left and 80 degrees on the right. Is that bad? No, it's good. At least 70 is the magic number for both eyes. So qualify for 2 years. During examination, medical examiner notices the driver is distant, lacks eye contact, and shows absolutely no emotion. So we're now talking about psych illness. So anxiety, depression, bipolar, things like that. If it's bipolar, that's a disqualifier. Just if you see the word bipolar, it's disqualified, just to let you know. So this individual, you're thinking depression by the way they're presenting themselves. So that's a disqualifier because you don't want anyone who's clinically depressed to be behind the wheel of a semi. Bad day. So the flat affect, then you're thinking about severe depression or schizophrenia. All right, disqualified. All right, so a driver admits to use of marijuana, disqualified. You can stop there. Not even in states like California or Colorado where it's allowed. It's a federal law. So since it's federal and the federal law does not state that marijuana use is legal with a medical card or whatever, then the answer is no, they're disqualified. Blood pressure 136/992, that means that's stage 1 hypertension, okay? Stage 1 hypertension defined at 140 to 159 or 90 to 99. that, if it's a brand new patient with any history of it, you can give them that certification temporarily, but they're going to have to come back and see you on medications. And after that, it's only going to be 1 year. Driver is taking Celexa, treatment of mild depression. Certified only with written clearance for the depression and medication from the treating provider. So just send them back to their treating provider who's given them the Celexa and have them go ahead and write for that. Just write a note saying, on the form that this patient's taken it, if they're stable, it's a generation 2 depressant, and it's acceptable, Celexa, not a controlled substance. Driver, insulin-treated diabetes, medical examiner can only accept form MCSA 5870. It has been properly completed within the last 45 days. So 45 days is the magic number for diabetes mellitus with that exam completed. Not 45 days from the date you did the exam initially, but it's 45 days within the last 45 calendar days. Okay. Medical examiner must receive that form and begin the medical examination no later than 45 days after the date was signed on that form. However, a medical certification determination does not need to be completed within 45 days, just like I was saying earlier. Minimum PaO2 for ABGs is going to be minimum of 65 millimeters mercury, okay? And then you can certify the driver. All right, a driver is taking Topamax. Topamax is also a seizure medication, so anytime you see that, you need to have clearance saying why they're taking the Topamax. Topamax is for migraine headaches as well, and so that's why this person's on the migraine headache medicine. Topamax. If it was for seizures, they would be disqualified. So Topamax is a medication used for seizures. The examiner will confirm the prescribing provider that the driver does not take the medicine to control seizures, and that he is actually taking it for headaches and is capable of driving a commercial motor vehicle, CMV. A 26-year-old driver presents the first-time certification, long-time history of ADHD, seeing a psychiatrist, being treated, verified his diagnosis with a psychiatrist. He is taking methylphenidate. Methylphenidate is like Adderall type of stuff, and that's a stimulant. All right. So max is you're going to be a 12-month certification with that letter. A driver has blood pressure of 168 over 112 and has been confirmed during the exam that it is hypertension. Stage 3 hypertension is disqualified. His blood pressure has to be less than 140 over 90, at which the time he'll have a maximum certification of 6 months. So you do the blood pressure, and then you'll give him a little bit of a break, and you do a blood pressure again, at least 2, sometimes even 3 times during that examination to see if you can get the blood pressure down. If it's still above that 168 number, then that's stage 3. Stage 3 is disqualified. And once you get him below that, the 140 over 90 range, less than 140 over 90 range, it's a 6-month certification from that point on. So he's disqualified at a 160 over 112 blood pressure. How long can a driver be certified? He's taking Micardis, HCT for hypertension, and is going to confirm blood pressure of 148 over 96. He's on blood pressure medicine, and it's not 140 over 90 or less. That means that it's not controlled, so you can give him a 3-month, one-time only extension. So because the driver has a history of hypertension, he has taken the medication, he had stage 1 hypertension during this exam, he would be provided a one-time 3-month certificate in order to lower his blood pressure to an appropriate level during that exam or that time. During the examination, a driver is found to be positive Babinski. So we're thinking about, what could be causing it? It's a neurologic, deficit. So a positive Babinski reflex is indicative of abnormalities in motor pathways and cerebral cortex, widely used diagnostic tool. Okay, so we all know this one. We're not here to practice medicine. We're just here to find if this person is certified or not certified, certifiable. The examination should obtain clearance from neurology prior to considering a driver for certification. So do not certify this driver without, and also give him a neurologic consult if he's never had this Babinski finding before. All the following required components of the DOT medical exam except for an ophthalmoscope type of exam. So vision, hearing, blood pressure, yes, but doing a ophthalmoscope exam, the answer is no. Okay, so there's 4 required components of every examination. It's vision, hearing, blood pressure, and urinalysis. Those are requirements. Everything else is just extra. All right? A driver reports the history of that he was treated for epilepsy as a 14-year-old and stopped taking medication, anti-epileptic medications years ago, greater than 11 years ago. So you think, hey, it's no brainer. This guy's good to go. Give him a 2-year qualification or certification. The answer is going to be disqualified. And the reason is, even though the driver reported exceeding 10 years waiting period, which is recommended, he's not been under medical supervision or care. The driver discontinued medication and use and treated outside of medical oversight. Since the driver cannot obtain a documented medical history, that this driver does not meet the non-discretionary epilepsy standard. So in other words, you can't qualify him. So he's disqualified because of the epilepsy, period. A driver reports for a recertification examination 8 weeks after having triple coronary artery bypass grafting. 8 weeks after having a CABG is way too short of a period. Following a CABG, you're talking at least 3 months. Since the driver is only 8 weeks, he's disqualified until he hits at least 3 months after a CABG. He needs 4 more weeks, okay? Once he's completed that, he gets a 1 year. Remember, if they have to have a lot of stuff going on and they have these special diagnoses like diabetes and things like that, it's never more than a year. It's never more than a year. All right, maximum number of hours a CMV driver, commercial motor vehicle, driver can drive in 7 consecutive days is 60. All right, so maximum number of hours is 60 hours for these drivers in a week, okay? So 60 to 70 hour limit. So a driver may not drive more than 60 to 70 hours of duty in 7 or 8 consecutive days. 60 to 7 is a 10-hour day, okay? All right, so many versions of this exam will have that 60-70 rule. So if you just remember 60-70, you've got 7 days, then 60 hours. If you got 8 days, it's 70 hours, okay? 60-70. All right, blood pressure of 166/92 would be stage 2 hypertension, right? Okay, so remember, stage 2 hypertension is at 160/179 on the top and 100/109 on the bottom, stage 2. Okay, there's gonna be, I'm sure, a question like that. The Lessagut sign, which is like the straight leg lift, checks for lumbosacral irritation, radicular irritation. So if they can't lift that leg, there's something going on in the lumbosacral region, radicular, okay? So straight leg raise is a neurodynamic test, examines the nerve root at the lumbosacral area, okay? The driver using hearing aids also, during the whisper test, must use the hearing aids when he drives, and he can be certified for 2 years. You have to qualify at least in 1 ear. Minimum acceptable spirometry readings, the minimum, okay, it's going to be FEV1, 65%, FVC, a 60, and FEV1/FVC ratio is 65%. Just remember, if FEV is included, it's at least 65%. The forced vital capacity is at least 60%, all right? And that's the correct answer, the minimum. All right, the driver presenting to the office marks down he's taken nitroglycerin for angina and has been doing this for several years. Upon questioning, he indicates that he's needed more and more nitroglycerin as of late. So this is indicative that there is something else going on. It's like not a stable angina. So because of that, not being stable, he's disqualified. He needs to get referred to a cardiologist for further evaluation. Don't certify him for a year. Don't provide a one-time 3-month certificate. It's not stable. Don't increase his medicines. You're not there to practice medicine. Okay. All right, the longest medical examiner can certify a driver a history of stage 3 hypertension is 6 months. Remember, stage 3 is always 6 months, not a year, not 3-month trial. Stage 3 is 6 months. That's treated in under 140/90. If it's not under 140/90, it's disqualified. Stage 3. Okay, driver is taking Wellbutrin, helps stop smoking. It's not for depression. Since it's not for depression, you can certify for 2 years. If it's for depression or anxiety, it is for 1 year. So no psychiatric condition involved, just trying to quit smoking. Okay. Wellbutrin. Okay. All right. During the history, the driver admits to having taken Benadryl for seasonal allergies. Benadryl is an old school antihistamine. It's one of those great, stage 1 type of drugs. Been around forever. Got to wait 12 hours before you can drive after Benadryl use. That's the key thing. So counsel a driver to never take Benadryl within 12 hours prior to driving. It causes sedation. All right. So driver has a history of moderate traumatic brain injury that occurred 3 years ago as a result of a car accident. He reports that he's fully recovered and provides a note from his neurologist stating that they suffered no seizures and they are able to return to driving. He does not list any medications or history. The examiner should certify the driver for only 1 year. All right. So the driver suffered no seizures with that traumatic brain injury, which is a TBI, has completed the required waiting period of 3 years and has medical clearance from a specialist. If the rest of the examination is unremarkable, the driver can be certified for 1 year only. Okay? 1 year. All right, driver reports suicide attempt 10 months ago, disqualify. If it's been less than 12 months, then you got to disqualify him, all right? Once you completed the 12-month wait period and they're being monitored and treated, take an SSRI, has a professional like psychiatrist or a treating doctor that can sign off on his paperwork, that's different. And it's for 1 year only. But less than 1 year, suicide attempt, disqualified. All right, driver Lisynthroid for the treatment of hypothyroidism has been taking it for around 6 months, feels fine now. His examination essentially normal. Best course of action, 2-year certificate. All right, so you can certify this individual for 2 years, no issues. Driver's hypothyroidism is well managed and he is asymptomatic. 2 years. Which of the following is correct regarding appropriate person complete and sign form MCSA 5870, driver insulin treated diabetic mellitus? All right, so medical provider manages driver's diabetes and prescribes insulin for the diabetic, and then documents it on the 5870. So medical document MCSA 5870 medical form. As long as the treating clinician completes the MCSA 5870 is in hand at the time of exam, defined as the medical professional who manages the prescribed insulin, then the driver is good for 12 months. Okay, driver should not be certified with an arterial blood gas reveals a PaO2 less than 65 at an altitude, this is the key, below 5,000. If it's above 5,000, that's different. But below 5,000, it has to make sure that it's below 60 or above 65. Okay. So threshold changes of 60 millimeters mercury for altitudes above 5,000. So just remember, if it's above 5,000 feet, then it can be 60. But if it's below, it needs to be at least 65. Okay, millimeters of mercury. An individual does not meet hearing requirements for the use of hearing aids and required federal hearing exemption. The examiner should mark the medical evaluation form accompanied by hearing exemption. All right. So if an individual does not meet the requirements and is using hearing aids to require federal hearing exemption, the box wearing hearing aids should not be selected on either the medical examination form, MCSA 5875, or medical examiner certificate. Instead, the only box to be accompanied with the hearing exemption is selected on the medical examination report and medical examination certificate. Okay. So accompanied by hearing exemption, so that when they're driving, they have to have that additional document. All right, driver presents his certification 6 weeks after suffering a myocardial infarction. Disqualified driver, remember it's got to be at least two months, 8 weeks. Also, key things you always have to remember is ejection fraction is at 50%. EKG does not show any ischemia and has had an ETT, transesophageal echo. Okay, and so that exceed the FMCSA standards. Now, the driver should be disqualified because he has not met the minimum wait time of 2 months after suffering a MI. Okay. Driver presents first certificate and checks yes for anxiety, depression, nervousness, and other mental health issues. The driver's health history portion and medical examination portion, he clarifies that he has depression and is controlled with medication and has had electroconvulsive therapy, shock therapy. Following ECT, the driver should be symptom-free for how long before being certified? 6 months. After ECT therapy, they have to be symptom-free for 6 months. Maintenance of ongoing ECT for depression is not certifiable. So if they're still going under ECT therapy, then they're not symptom-free. So if they've done ECT therapy for depression and is controlled well without any additional therapy, it needs to be done for 6 months before you can certify them. According to FMCSA regulation, which of the following must be the medical examiner's evaluate to, okay, according to FMCSA, which of the following must the medical examiner evaluate when examining the driver's eyes? Just pupil reactivity. You don't need to worry about corneal thickness or iris symmetry or anything like that stuff, so they can have anoscoria and still qualify, okay? So pupil reactivity is the only option that is included for medical exam report form for physical examiner for both eyes, okay? This is a cranial nerve test, and that's why. So, significant neurologic problems must be worked up with explanation that clarifies whether or not the driver has a condition that may interfere with the ability to safely operate a CMV. According to FMCSA regulation and guidance, medical qualification for 2 years can be given to a driver who has a SPE certificate. So if a person is like missing a limb, amputee type of thing, all right? So they have to have the certificate in hand, and then, no pun intended, and is for a 2-year certificate, okay? And they can, as long as they can demonstrate the ability to complete all things required to run around and drive a CMV by their job description. During the driver's visit with the medical examiner, the driver complains of severe pain in his finger. That's been going on for 2 weeks after it was punctured it looks infected, it's swollen. The medical examiner inquires the driver's state of pain. It's worse with gripping a steering wheel. You assess the grip strength. Grip strength should be at least 110 pounds, so if they can barely hold the steering wheel, then they are considered temporary disqualified. But if they can hold the steering wheel, even with the active infection, you can qualify them and focus your DOT certification on whether or not this is a permanent disability versus just something that's happening because they have an infection. A new driver who had a myocardial infarction, MI, 6 months ago, is certified after completing all acceptable exercise tests and cleared by a cardiologist according to FMCSA guidelines. Which of the following is recommended regarding recertification, exercise tolerance test monitoring intervals? Every year is a recertification, and every 2 years is exercise tolerance testing. According to the FMCSA medical guidelines, after an MI part history, there's a significant increased risk of another MI within 6 months to a year. Therefore, maximum is 1 year certificate, and then every 2 years you have to have ETT. Which of the following is true on the Romberg sign? Romberg sign, it's a proprioception type of test, and positive it's positive test if you have the inability to maintain an erect position for 60 seconds with both eyes closed. So if you have your eyes closed and you're drifting one way or the other, that's positive Romberg test. All right, so this is an example of a question regarding just how smart you are in medicine. That's it. All right, so which of the following stages of hypertension calls for a medical certificate that requires that expires in 1 year? Stage 1. Okay, medical certificate, driver, stage 1 hypertension expires in 1 year. First exam, stage 2 examination results 1 time, 3 months medical certificate. Stage 3 corresponds with inability to get certified. You're disqualified until you get it below on medication, stage 1. Okay, so it has to be below 140/90. Which of the following is true on psychological disorders in drivers? Drivers with a mood disorder may, during a manic episode, exhibit grandiose things or thought processes, impulsiveness, irritability, aggressiveness. So if a person has psychological disorders such as any of the above, you can't qualify them to be a driver. So they're disqualified. Drivers with an active psychologic or psychotic disorder will exhibit unpredictability behavior accompanied by poor judgment. Drivers with a mood disorder will exhibit slower reaction times, such as depression episodes and grandiose impulsiveness, irritability, and aggressiveness during manic episodes. Drivers who with personality disorders may exhibit inflexibility and maladaptive behaviors, along with an increased rate of irritability. A driver without a history of hypertension is found to have blood pressure of 145/80 during the exam. What's the best step? Obtain a second blood pressure reading later during the exam. So just remember, get 2 blood pressure readings on these individuals, especially if they have no history of blood pressure problems. If the blood pressure reading of the driver equals to or above 140/90, a second reading should be taken during that exam. Okay. When deciding on a commercial driver should be medically certified, What is the fundamental question the medical examiner should examine regarding cardiovascular health? Does the driver have a cardiovascular disease that increases the rate of sudden death or incapacitation? All right, so when looking at the cardiovascular health of a driver, the question whether or not the driver has cardiovascular disease that increases the risk of sudden death or incapacity, creating a danger to safety and health of others, as well as public sharing of the road. While history and family history of such disease is important, they are not the fundamental questions necessary to ask. So family history is not a huge deal, but active issues with cardiovascular disease, that is, okay? And then next question. If a medical examiner uses the number 1 during the physical exam, the medical examination is talking about the general appearance. Number 1 is general appearance. 1 refers to general appearance, 4 refers to like ears, 6 refers to heart, 8 refers to abdomen. So 1's general, number 4 is for ears, number 6 is for heart, and number 8 is for abdomen. When conducting vision examination, the driver must have at least a 20/40 on his test for distant, okay? Driver must have at least 20/40 distant vision, visual acuity in each eye, with or without correction. And a higher standard is not necessary, all right? And so, so 20/20 or 20/10, yeah, awesome, but 20/40 is the minimum to pass. All right. Which of the following is not true? And that must be immobilized. Which of the following is not true on a physical exam? There's a maximum height requirement. There's no maximum, height requirement or minimum height requirement. That's not true. You can be super fat. You can be super tall. It's okay. There is no maximum on either or. Okay. All right. So there's not a fact of minimum or maximum height or weight requirement for drivers. For each of the body systems, mark yes on the report if an abnormalities are detected, or no if the body system is normal. So if the body system is normal, you put no. The medical examiner must document all abnormal findings on the report form, even if it's not going to disqualify them. All right. Which colors do we have to test the drivers on? So you must test green, amber, and red because it's a stoplight. And so it doesn't have to be a stoplight picture. It should just be pieces of paper, green, amber, and red. If they throw something at you like, hey, is blue required? No, blue is not required. Okay? So we're just going with the stop sign. What medication causes xanthopia? Xanthopia is that yellowing of the vision. So if you're taking this medicine, all of a sudden your vision's getting more yellow and you're having difficulty determining colors, like on a stop sign or a stoplight, the medicine that's usually the culprit of this is digoxin. Okay, so random medical knowledge. That's what this question is all about. So, but remember, digoxin, yellowing in vision. So if you've got a little bit of yellowing in your vision, you're on digoxin, that's not something that a driver can have in their system, okay? So bad drug. Which of the following is assessment of the L4 nerve root? Remember we were talking about, doing a straight leg raise for lumbosacral? Well, L4 is checked with reflexes. So you can check the L4 root with the patellar, so tap them on the knee. And that will check for nerve root pathology. All right, so a driver presents with a DT physical, a lateral pulsation, 2 inches superior to the umbilicus or belly button. So you got to refer them to emergency medicine because you're thinking that is a bruit, and a triple A bruit is indicative of an aneurysm in your abdomen, which is going to kill the patient, which, if they're driving a big rig, would be a bad day for everyone on the road. So Do not qualify them. Send them to the ER for further evaluation if you can hear a bruit in their belly. All right, driver with limitations of 45 degrees of the neck to the right or to the left, but can view both side mirrors, can be certified for 2 years. If they have limitations, but they can see both side mirrors, they can be certified. The FMCSA has not adopted a standard cervical range of motion yet, okay? So even though it's decreased, it doesn't matter as long as they can still see the mirrors. And that's for 2 years. Driver presents with a history of isolated TIA 6 months previously. He presents with a return to work letter from his primary care provider and his neurologist. The driver has taken hydrochlorothiazide and simvastatin. All other suspect or aspects of the exam or the history are normal. Can you give him a qualification letter or a certificate for 2 years? And the answer is going to be no, disqualify. The reason is TIAs lead to CVAs and must have 5 years before you can be certified again. So if you have a patient with a TIA, you have an increased risk of moving on to a CVA within 12 months to 2 years of having the TIA. So they have a 5-year wait. Which of the following is criteria for certification after MI? Must have an EKG showing no signs of ischemia, must have echocardiogram proof of ejection fraction greater than 40%, and ETT showing 85% of maximum predicted heart rate. All the above. So, and then you're going to grant them a 1-year certificate, 1 year post-MI. A driver presents for initial certification. His blood pressure is 180 over 102, tested, treated on amlodipine daily already. You disqualify him. You just disqualify him. They have a blood pressure that's that high and they're on amlodipine. Yeah, they're being treated. No. It's consistent with stage 3 hypertension. Naturally, that is not going to be a person that you want behind the wheel of the vehicle. If you can get his blood pressure down to less than 140 over 90, you can give him a 6-month card. 6-month card, okay? Okay. So the driver reports that he is hospitalized recently for palpitation. He states that he was diagnosed with AFib and is put on warfarin. And which of the following is correct certification criteria for AFib? You got to wait at least 1 month after they were treated for AFib, and then they have INRs monthly if they're on warfarin, and then you give them a max certification of 1 year. Remember, if there's any issues ever, 1 year. All right. A waiting period of AFib is 1 month with a monthly INR check, and then max 1 year certificate. Okay. Driver presents certification, reports hospitalization, recent chest pain, states that he was diagnosed with MI and underwent a left CABG. So a coronary artery balloon angioplasty. Put on Xarelto and presents for certificate as a driver. You got to wait 2 months after you have an angiogram. Okay, so left coronary artery balloon angioplasty after an MI, you have to wait 2 months. They're on Xarelto, so you don't need an INR monthly. If they were on warfarin, you would. And you can certify this for 1 year. All right, since the angioplasty was completed, results of an MI, got to wait 2 months. Without an MI, the waiting time would have been 1 week. So just having an angioplasty without the MI, that's 1 week, okay? No INR required for this AFib diagnosis because they're on Xarelto. The driver presents for recertification, admits to having a stroke 2 years ago that has resolved without any residual deficits, presents with a clearance from his neurologist and has not had any seizure activity or medications for seizure. All right, he's not on any stroke medication either. He's otherwise medically fit. Certificate can be for 1 year. So the waiting period after a cerebellar or a brainstem stroke is 1 year. Driver must have met the waiting period and obtain a clearance from neurology in order for you to pass him on for that 1 year certificate. Driver presents an examination following a spontaneous pneumothorax 1 month ago. The records indicate that the pneumothorax was reduced, and driver's force vital capacity (FVC) is 58%. Remember, FVC has to be greater than 65% of the predicted. All right, so do not certify this driver. You don't certify him because the fact that this is inadequate FBCs. You perform a vision portion of the interstate CMV driver's physical exam. Other than the medical exam, who can do this? On the medical exam, you can be a medical assistant on there working on medical exam. You can be a physician assistant. You can be an ophthalmologist. You can be optometrist. You can be a nurse practitioner. You can be a chiropractor. You can be an MD or a DO. So, but for the vision portion of it, medical examiner, medical assistants, ophthalmology, optometrists may perform the vision test. Okay. A medical examiner can be a PA, chiropractor, MD, DO, nurse practitioner, just FYI. Which of the following mandates disqualification per regulation? If a person has hypersomnia, they fall asleep just sitting there, narcolepsy, or ICD placement, so they have that indwelling catheter with that defibrillator. These are all disqualifications for being a CMV driver. According to regulation, which of the following can grant drivers an SPE certificate? The FMCSA. So it's the certificate can be issued by them. Okay. Now the person doing it's going to be an orthopedic surgeon, but their certificate's issued by FMCSA. Only the FMCSA can grant the SPE certificate at one of the FMCSA centers. All right. As a certified medical examiner, how long must you retain a copy of the medical examination report form for each driver? And that's 3 years. Okay. Medical examination will need to be provided. The medical examiner you will need to provide a copy of the medical report form to the driver who is applying for or renewing as the SPE. That's that skill performance evaluation because they're missing a limb. Hearing exemption certificate, seizure exemption certificate, any of the above. Okay, so you have to provide a copy of your medical examination report form to the driver who's applying or renewing with the following documents: SPE, hearing exemption, seizure exemption. Since the medical examiner does not complete any of these 3 certificates listed, they are approved by the FMCSA. The driver must complete those medical examination report forms to apply for each of the examination or exemption certificates. So they have to bring those forms in with them. Which of the following is true of the vision requirement for commercial drivers? Central distant vision acuity has to be at least 20/40 in each eye. Okay. The Snellen chart measures the static central vision acuity. The requirement for central vision or central distant visual acuity must be at least 20/40 in each eye, and distant binocular vision acuity at least 20/40. Okay, so 20/40 is the magic number. Test results must be recorded on a Snellen comparable values. Okay, eyeglasses or contact lenses may be worn to meet distant vision acuity requirements. When corrective lenses are worn, they must meet vision qualification requirements. Binocular lenses are not authorized. Which is accurate regarding the hearing test required for motor vehicle drivers? If the driver perceives a forced whisper in one ear at 5 feet, he has met the hearing requirement. Okay, has to be at least 5 feet if you're going to do that exam, and at least 1 ear. If they fail that, then you're going to send them for the actual audiology exam. All right. When a driver who wears hearing aids is unable to pass the forced whisper test, referral is sent to audiologist, ENT, otolaryngologist, hearing aid center, any of the above. Okay. Hearing aid must be used during the whisper testing, and also used during driving if that's what happened. So if you test it with a hearing aid, they have to drive with a hearing aid. Which of the following frequencies is not included as part of the audiometric hearing test for commercial drivers? And that's 4,000. They test 500, 1,000, 2,000, but not 4. Okay. Commercial driver is taking Coumadin. He must undergo monthly INR exams. Okay, so you got to do monthly INR monitoring and proof of that monitoring in order to pass if you're on Coumadin for, say, AFib or whatever. Okay. Now remember, we're talking about the patellar tendon for L4. If you're going to check L5, S1, it's the Achilles tendon. So you check for Achilles reflex, and that's just general medical knowledge. Driver presents initial certification, drives 3 months following an MI in the hospital. Left ventricular ejection fraction must be at least 40%. Remember, 40% is the magic number for EF, okay? It has to be at least that. Okay, what is the minimum waiting period following CABG? And that's going to be 3 months, okay? Remember, if it's a balloon graft, you're talking about 8 weeks after MI, and the reason it's because of the MI. If it's without the MI, it's 1 week. With a CABG, it's 3 months. Following an uncomplicated elective procedure, just like I was saying, it's 1 week, such as doing a balloon graft or balloon angiogram without MI. MI increases it to 2 months. Cardiac condition is disqualifying. Oh, anytime you hear cardiomyopathy, cardiomyopathy is disqualifying. You have mitral valve prolapse, Epstein anomaly, aortic valve repair, they're good. But if you've got hypertrophic cardiomyopathy, that cardiomyopathy is always going to be disqualifying, and that could be restrictive or hypertrophic, okay? Driver who exhibits difficulty breathing and a history of COPD should undergo additional pulmonary testing. FEV1 of less than 65% is a fail. All right. So obvious difficulty breathing and resting portion of the indicator of additional pulmonary function testing. If the forced expiratory volume in the first second of expiration, so FEV1 is less than 65% of the predicted arterial blood gas requirement, should be evaluated. Okay. Driver's fixed deficit, use less to his less than his whole hand. Which of the following is regarding certifiable for the driver? As a medical examiner, we can choose if it's a hand injury, for instance, and they're missing, like, say, 3 fingers or 4 fingers, and they're able to prove that they have good strength in that hand and they can drive, then you don't need an SPE certificate. But it's not medically disqualifying unless the driver has an SPE certificate. So loss of a hand, you got to have the SPE certificate. If it's less than, all fingers, it's like 3 fingers or 4 fingers, and he's able to actually do everything with it, with the hand, and can prove it by the medical examiner, you can pass him. Otherwise, he needs an SPE certificate. Urinalysis is a required part of the driver evaluations. If the urinalysis indicates glycosuria, medical examiner may elect to perform a finger stick to obtain a random blood glucose. All right, so it's not going to spill sugar in the urine unless it's really high on the blood sugar. So that's why we want to get. That's why we want to get a fasting blood sugar. Let's see here. You are required to perform urinalysis dipstick as part of every driver certification and recertification. An abnormal result of which of the following mandates a temporary disqualification. So if you find blood, protein, or glucose in the urine, is that going to disqualify them? And the answer is no. None of the above will disqualify them. Should definitely be documented and have the patient go see the provider. Each of the following mandates disqualification for the driver with a history of alcoholism. He has not successfully completed counseling. He has a current diagnosis of alcoholism that are going to disqualify him. Now, if he voluntarily attends 12-step program and to maintain his sobriety, that's not going to disqualify him. The other will. This won't. Ongoing voluntary attendance is really highly recommended, 12-step program type of thing. Female driver presents for recertification who is in her fourth day of menses, shows a lot of blood in the urine. What do? Well, you give them a 2-year certificate. Doesn't matter. All right. The initial certification of driver is found to have blood pressure 165 over 105. Stage 3 hypertension. You give him a certificate for 3 months. They come back and the blood pressure is under 140 over 90. Then you can give him a 1-year DOT certificate. So it's 165 over 105. So it's stage 2, not stage 3. You can do a 3-month certificate, get him on medications. If it was over 180, over 110, then no, that's stage 3. You can't, it's disqualified. They got to get them on medication and be below 140 if that was the case. This case, you give them initially 3 months, alibi, hey, they're going to do your thing for 3 months. Let's get that blood pressure under control. They're back in 3 months. It shows the blood pressure under control. Now you can give them 1 year. Anything, if it's a stage 3, it's 6 months max. Which of the following is true concerning a driver who presents for a DOT examination but does not speak English? We don't care about if they speak English or not. It's not factored into the determination of the exam as long as we can obtain the proper history of the exam. Okay? Which of the following accurately describes FMCSA's requirement regarding grip strength? Doesn't require any type of specific testing for grip strength. So just as long as they can, perform their duties. Person has an infection to their ear, will that disqualify them? No, it's not going to disqualify them. They have an infection to their ear, just send them to their doctor, give them their medications or whatever. Driver with a history of congestive heart failure, asymptomatic. must have at least a 40% ejection fraction. If it's less than that, they failed. More than that, they're good. Driver presents with for certification. Just had surgical repair of an aneurysm to the left leg. What was the minimum waiting time? 3 months. Okay. After an aneurysm, you want to make sure they are waiting at least 3 months. They can develop more issues if it's less than 3 months. Okay, so you can't approve that. Which of the following is true regarding FMCSA blood pressure regulations in commercial motor vehicle drivers? Only blood pressure readings taken during the physical exam count. If you have blood pressure readings that were normal from their home doctor, that does not matter to us. A blood pressure reading greater than 145/89 means that it's stage, 1 hypertension, and then you confirm it with a second blood pressure reading. Trained assisted personnel may take and record BP, so MAs, PAs, nurse practitioners, MDs, DOs, whatever, chiropractors. All right. Disqualification of individuals attempting the exam, opioids, marijuana, alcohol. They have ongoing issues with all the above. They're all disqualified. As part of the evaluation, are you supposed to perform testing for any of the above, alcohol or marijuana or opioids? And the answer is no, none of the above. Testing for controlled substances is not part of the physical exam. All right, correct statement regarding certification of a commercial motor vehicle driver. There is no work restrictions permitted for commercial motor vehicle driver. The ability to do tasks include lifting, certified. SP program is intended only for individuals who have fixed deficits, like they have an amputation. It's not for Lou Gehrig's disease or whatever. That things that are continue to grow, propagate. It's progressive diseases. A new complete DOT examination must be performed in order to issue a new medical examiner's certificate. Okay. All right. Pretty self-explanatory. Which of the following is a not on a mission of the FMCSA? Develop and enforce data-driven. Which of all is not a mission of the FMCSA? Oversee prosecution of criminal negligence. All right, yeah. So FMCSA is not out there to prosecute people. It's just to help keep this highways and byways safe. That's it. That's its mission. Which of the following cases should you mark an exam as incomplete examination? All right. When the driver just gets up and leaves without the exam being complete, that's considered incomplete. So if you're doing an examination and the driver doesn't want to participate, he doesn't want to answer your questions, he just doesn't want to be involved and walks out, and then it's incomplete. Gets documented in the system as incomplete. It is the responsibility of the motor carrier to make sure that the commercial motor vehicle drivers meet in each of the following standards, with the exception of they must be 21 years old. They must speak and read English well enough to understand highway signs and law enforcement. Have a current medical examiner's certificate on file. That's the motor carrier's responsibility. What's not their responsibility is provide their full medical examination report form to the motor carrier. So that the driver doesn't have to do that. It's their decision to do it. Hemoglobin A1C level indicates the diagnosis of diabetes when it's 6.5% or higher. That's just a medical knowledge question. A driver presents for the first DOT medical examination. The driver is 48 years old, Starting truck driving school, a second career. Driver has hypertension. That's 176 over 124. That 124 is stage 3 hypertension. They're disqualified. Yep. Come back later, as long as it's under that and they're on medication, they can give them a 6-month certificate. Okay, so a driver has a previous diagnosis of hypertension. Today, his blood pressure is 146 over 88. What certificate time should be given? Well, excuse me, the driver has no previous diagnosis of hypertension, new onset hypertension. Today, blood pressure is elevated. 146 is stage 1 hypertension. All right? You can give them up to 1 year from that point on. Driver's been taking medication for hypertension for 3 years. He is inconsistent with taking his medication. Today's blood pressure is elevated, and this is a guy who's on blood pressure medicine. You can give them a one-time certificate for 3 months so they can get themselves right, and then bring them back and check their blood pressure. If it's not correct, then you can't qualify them unless they are within the qualification zone of less than 140 over 90. All right, what is the maximum certificate period for obstructive sleep apnea? That's 12 months. Okay, remember, anytime that they have some special type of comorbidity diagnosis code, it's always 12 months. Driver sustained myocardial infarction 1 month ago. Remember, MI is at least 2 months. Okay, he's following up with his primary care again in 1 week, and he's unsure of his medications, but is asymptomatic. Should he be certified today? The answer is no. There is a written recommendation waiting period of 2 months. It must be thereafter before certification. Driver presents the first DOT physical. Driver's height is 58 inches. Driver's weight is 105 pounds. Super short, super small, big deal. The examiner should be concerned about certifying the driver because the driver may not be able to handle the oversized steering wheel. That's about the only thing that will be accurate. There is no height restriction, no weight restriction. You gotta just make sure that they can handle and do their job. That's all. Just because they're super short and super light. Driver denies using illegal drugs, but looks very haggard. Has fresh needle marks on the arm. Can you order lab testing for drugs? And the answer is yes. You can. If you suspect there's illicit drug use and you're seeing it, you can order it. But a non-DOT drug test can be ordered. Refusal to test is a failure. So if the person's saying, no, I'm not going to do it, then you can fail them. You don't feel like you have to pass them. What's the maximum allowable BMI of a driver? They can be as fat as they want. There's no standard. A driver has a long history of major depression. His only medication is Paxil, and he reports no side effects. 3 months ago, he attempted to commit suicide by hanging himself. Remember, you got to wait at least 12 months after a suicide attempt. So the answer is no. Got to be at least, cannot certify him, needs to wait at least 1 year. Sorry for his luck. Driver examination is unremarkable except for the fact that he has panic attacks. These are under control with Xanax, which is a controlled substance. Reports to no side effects. What certificate is appropriate? Xanax is generally considered to increase crash risk. Use of this clinical judgment, use clinical judgment with this. Benzodiazepine use is typically a disqualifying factor. Additional consultation with treating physician may be needed. So, in other words, if they're on Xanax, I would not support them driving a big rig. They definitely need have their prescribing physician write a letter for them about this medication, and I would not qualify them. So no, they need to come off of that drug. What is the minimum